For years, women have been the ones to get plastic surgery, but now more men are getting their own nip, tuck, or lift. Tomorrow night on News Channel 9 at 10, reporter Kathy Hernandez looks into why men are going under the knife these days. We'll hear from a man who first just wanted to have a growth removed, but decided to go all the way, the whole 9 yards, he says, with a facelift after meeting the plastic surgeon.
He showed me male patients that he had before and after, and I thought, what the heck? I'm here, I'm going under the knife, go the whole 9 yards.
So Kathy Hernandez will have that story for you tomorrow night. You'll see it only on News Channel 9 at 10. Mirror, mirror on the wall. More men who don't like their looks are doing something about it, even if it means going under the knife. News Channel 9's Kathy Hernandez went to a plastic surgeon's office to do some research on this trend, and she's live in the News Center tonight with a special report for you. Kathy?
Dan, for years, women have dominated the plastic surgery market, but nowadays, more men are getting their own nip, tuck, or lift. I talked to a man who chose plastic surgery and says other men should be confident about the results.
Plastic surgery. It's mostly about women changing a feature they don't like or refusing to give in to time and age.
I average around 25 new consultations a week, so 100 new consultations a month, and 90% of them are females.
But times are changing.
Actually, it was like 95, so the male population doubled up from 5% to 10%.
According to a recent LA Times report, more than twice as many men are receiving plastic surgery compared to 15 years ago. One of those men is Henry Parisi.
Several years ago, Parisi went to see Dr. Sozer at El Paso Cosmetic Surgery. He had a growth on the side of his jaw, and he wanted to remove it.
I got to talking to Doc Sozer about doing some extra things for me, and he showed me some photos of his male patients before and after. And from what I could see, all of them kind of looked refreshed. They didn't look plastic or overdone.
Just like that, he was sold on cosmetic surgery.
I got a little bit excited. I thought, what the heck? I'm here, I'm going under the knife, go the whole 9 yards.
So this husband and father did just that. His doctor removed the growth and gave Parisi a facelift.
I had some bags under my eyes that he removed, and a little bit under my chin, and that was about it.
In no time, he was back to his normal life.
I was back to work in about a week. Really felt no pain, no discomfort.
For the first time in a long time, Henry Parisi likes what he sees in the mirror.
Great. No regrets.
He tells a success story, but other men have reservations.
Everybody has doubts, especially if you're having surgery for a reason which is not absolutely necessary. To make them more comfortable, I usually see every female patient with a female nurse with me. With the males, I just see them by myself. So it's just kind of a male-to-male conversation. I think they feel more comfortable with that.
Don't worry at all. You know, it's really not a big deal. And you look better afterwards. So go for it.
I think now it's becoming more acceptable, and men are looking more into plastic surgery. And I think this trend is going to be from 10 to 15, 20. I think it's going to go up.
Dr. Sozer says men leave his office with a sense of confidence.
Once they see the result, all of them say it was worth it.
Dr. Sozer says liposuction to remove fat is the most popular surgery for both women and men. Other popular male procedures are nose jobs, facelifts, and even breast reductions. Live in the News Center, Kathy Hernandez, News Channel 9.